I welcome you to the Healthy Heart, Healthy Life Pune series, session number 8. Today we are going to discuss very interesting topic of angina differential diagnosis. That means we are going to talk about conditions which mimic angina, look like angina, but are not actually angina. And it is so necessary to know about them. I'm Dr. Neelkant Karandikar, cardiologist. My WhatsApp number is 98220 you already know about my attachments and my achievements. Now, in our previous session, we have discussed in detail about what is angina, the chest pain, chest discomfort, tightness or pain in the chest, which indicates or suggests that the arteries supplying blood to the heart, called coronary arteries, have atherosclerotic blocks or plaques in the vessels, the coronary arteries. So this is something which we have discussed, the types of angina, how to diagnose angina, etc. But today we are going to discuss one condition which mimics angina very much. In many, many cases, we come across such a situation. We know that the heart is enclosed in the rib cage. This is the heart, these are the two lungs by its side, and this in white is shown the rib cage. And there are muscles connecting the ribs, which are located in this rib cage. The main muscle of the chest is called the pectoral muscle on both the sides. You know, when we see wrestlers and bodybuilders, they very proudly show off their pectoral muscles along with the other muscles. Now, pain in the muscles covering the chest, especially the pectorals, is very, very common. You know, as you can see here, the red area, this is the area where this gentleman is suffering or is experiencing the pain. Now, muscle strain, sprain, or spasm, as it is called, is due to overexertion or injury to the chest wall muscles, like the pectorals of the picture we saw just 2 slides back. This discomfort is usually an ache or soreness that worsens with specific movements or certain positions. So if I had chest pain in this part of my chest, and if I raise my left upper limb, left arm, the pain is going to get aggravated. Or if I turn like this, again the pain will get aggravated. So if movement aggravates the pain, it is likely to be muscular pain. Other very important uh, criterion is if you press on the area which is paining, and if the pain increases, it is likely to be muscular pain. Tenderness is found over the muscle belly rather than the rib joints in this situation, in the muscle strain, sprain, or spasm. Other very important thing about this muscle pain is that it is not like angina. You know, angina we had discussed in our previous session that it comes on slowly, stays for a little while, usually 2 to 5 minutes, and then dies down slowly. So it will come on if you exert or have an emotional stress, and it will come down, the anginal pain, I mean, when you take rest or you take that tablet of called as a nitrate drug, which you put it under the tongue, it will get relieved slowly. Muscular pain is not like that. If somebody comes and says, oh, I got a pain like this, came and went away quickly, likely to be muscular pain. Or the other criteria which we saw, that if you press on it, it increases, or if you move your body, the related muscle, then also it increases. Now let us come to the rib cage, which is again very close to the heart. Here is shown the rib in blue, the cartilage which connects it to the breastbone in yellow, and the breastbone in green. Now at the junction of the rib and the cartilage, It is called as the costochondral junction, a very common area where pain can occur, and that is due to costochondritis. It is due to inflammation or swelling of the cartilage connecting the ribs to the breastbone. So it is at the joint, as we just saw. It is sharp, localized, and increases with direct pressure. So, second common cause of chest pain. Many times, patients come to my clinic and they say that, oh, doctor, I'm having so much pain over here. Is it related to the heart? Please find out. And it is only a checkup which can make it clear whether it is heart pain or muscle pain. Sometimes it becomes they look very similar to each other. I have just discussed one point today, chest pain. I thought let us keep the video short because everybody is busy and it will not take too much time watching this video. We have discussed chest pain due to muscle and the cartilage pain. Next time we'll take another point. Thank you very much for attending this session, and I look forward to seeing you in the next session also. If you have already subscribed to my channel, I'm very happy. If not, please do subscribe to my channel. Also give me thumbs up to encourage me to give you more and more information like this, which will help you keep healthy, keep strong, and live a long, happy life. Thank you again. Thank you very much.